normal. Wash my hands. How's it going? Been skating? You still skate?
No, I wish I did.
No, you do not? Really? Your children?
No, I have boys.
Nothing?
Do
Yeah,
you boys
hockey?
want to figure skate? No, they're not even interested in hockey.
There's some boys that figure skate. Are you?
Yeah, talk to my husband about
I can
that.
take this on and on and on. No, just saying. Yeah, I don't really know my boys' favorite skating.
We have gymnastics and karate, taekwondo, and now I have a 12-year-old, believe it or not, who is doing football camp.
Oh, cool.
Can you believe it?
Okay, I would set you back. Let's see. What kind of grunge mouth are we looking at today?
Kind of how much coffee did I
I'm not
have?
gonna look. Okay.
Nope. That has
I would-
makeup on it. Makeup. Browns are not good.
Well,
for you.
I don't
Those are
need that.
special.
Well,
Anyways.
Hold on, let me think about this. And you're doing fine, teeth-wise, yes?
Yeah.
Yeah. Now, I don't know if you guys want me to do that. I do it because I want the patient to say yes. I don't know. She says she's doing fine. Yes, yes. You know. Okay. And if you guys say don't do
Well,
that,
she
well,
didn't
I'll
say
try.
that earlier. She said, well, I don't like the looks of that tooth. Because she'd been looking at it.
Okay.
So
well,
they might respond that way.
Right.
I would normally
Which
say.
is good to say that, because I might say, no, I'm really worried about this too.
Okay.
Oh, what she's showing me pictures of now. She's.
I would say how's she doing? Just talk to me.
All right, certainly. I went ahead and took an intraoral picture of a tooth on the upper left.
That's not how you would normally do it, though. You normally say medical history.
Oh, you want me to go through
Well, I
all
don't know.
that?
What
Yeah.
are we doing?
We were, yeah.
Oh,
We're
okay.
just jumping to. We
Jumping
were
right
just
to. Okay, go
jumping
to the jump.
I was.
I'm just
Jumping.
trying to think. How's she doing?
I had to refix my brain, but we took an intraoral photo. There's a deteriorating amalgam up here, which, let me see. Our problem, Laura's problem is that we have a large silver filling, and I wanted to go ahead and show her these little fracture lines that are starting to occur with this tooth. And now, so our problem is that this tooth already has the ability to crack. We can see that. And our, the possible consequence of what could happen with this tooth is that if we bite down on that just right, possibly breaking that tooth, or even possibly losing that tooth, depending on how it breaks. And now I was talking about solutions with Laura for this type of problem. And we could do a crown and put a full covered restoration on that tooth to make it so that we're not experiencing this fracture lines and we can hold that tooth together and ultimately save it.
Okay. That's it. It's good. Don't add to that very much. How do you feel? Do you have any questions for me?
Okay, so I'm going to make you give me the phone consultation.
What do you want me to do?
I want you to give me as the patient the phone
You, Laura?
consultation.
How long
Yeah.
have I known you for?
I don't care.
No, I mean, how long have I known you?
That's a question he asked.
How long? I've known you
2
for
months.
several
3
months
months.
now. 3 months now. You trust me?
Of course I do.
Okay.
What if
Well,
I said no?
Well, no, that's fine. You're not, I mean, you say no. I just want to know, do you trust me? Well,
I've only
yeah.
known you for 3
It's the
months. I
best-
don't trust anybody at 3 months.
Okay.
That's a golden rule.
Well, I would look at all your teeth and I'd say, okay, this is a tooth. I agree with Kara, and that
No
tooth's
problem.
weakened, and that's what I want you to do. I mean, if I look at all your teeth, normally I would pick the highest priority.
We want you to just repeat the problem, the
The
consequence,
problem with
and the
that,
solution.
the problem with that tooth is, what, like she said, there's a big filling. It's a weakened tooth. It's not cavity. I know you don't hurt. I know you're chewing fine, but that tooth is weakened. It's not a cavity, but the structure is the structure is compromised in that. So, the best restoration that we have in dentistry is called crown. I usually touch people. That tooth is coming apart. You got me? And what I do is I make crown restoration.
My hands are cold.
Crown restoration holds it together, and that's the best restoration I have.
So you
That's
told her
my-
the problem. What's
Yeah,
the
if
consequence?
we don't do anything, then within generally that tooth right there, my experience is going to tell me that 3 to 5 years, something's going to pop, and you're going to go, oh, and that hurts. And the problem with that is that's a whole different set of can of worms. I mean, and the prognosis is always better if you're doing preventive care and not having a train wreck before it,
Proactive.
before it goes on.
It's going to be hard for you.
Yeah, it is. Just tell you what to do. You need a crown on the too.
You know why? Because the thing is, we need them doing the technique we're going to be tracking the case acceptance on
Right.
each stop.
Right.
And like I told you, you may have 75 to 85% case acceptance.
Right.